Welcome to all the Education Minnesota members and their spouses. You are viewing the 2017 Medicare Made Easy seminar. I'd like to thank you for joining me today. My name is Tim Schatz, and you'll see my contact information in the bottom left corner of this first slide. Today what I'll be talking about will be the Education Minnesota and Minnesota Health Insurance Network partnership. I'll give you a little bit more background about how our two organizations have aligned, and specifically with the Education Minnesota ESI member benefits. We are actually a preferred vendor when it comes to members and health insurance related questions and Medicare as well. Then I'm going to give you a background on some of the fundamentals of Medicare. We're going to talk about the A, B, C, and D of Medicare so you have a better understanding about what that means. And then we'll talk about some general health options when you're working with Medicare. And then finally, at the bottom of the screen, when you go back to the home page, you will see that there are going to be 10-minute videos for each of the three carriers that we're offering through Education Minnesota. That they are offered through UCare, Medica, and Humana. So each of those carriers will have their own 10-minute clip where you can learn more about their specific products as well. So a little background about first my company, Minnesota Health Insurance Network. First off, we are an independent agency with over 25 years of experience, and really our job is to help you as a Education Minnesota member understand what your options are in retirement for health insurance. Now, when we're looking at retirement, many of us might work past the age of 65 or really have questions around Medicare, and that's specifically what we're going to talk about today. A little bit about our partnership with Education Minnesota and their member benefits area is that they were receiving a lot of questions from members about what are my options when I turn 65. Medicare can be a very tricky time, and you'll notice quickly that you'll receive a lot of mail delivered to you each and every day. And it's hard to decipher what you should keep, what you should throw away, what's an advertisement, and what is, a letter with high importance. So what we're here to do is to help you through that transition and to help you understand what your options are and to make sure that you don't miss any of the important deadlines when you're evaluating your Medicare. So really what happened was Education Minnesota, their member benefits division, actually reached out to us about 8 years ago because of all these additional questions they were receiving from members. So they went out to bid, so to speak, and they evaluated many different brokerage firms and found that our brokerage firm offered a lot of resources to their members at no additional cost. And that's really the reason why they chose to endorse us. Is not only do we work with the majority of providers in the Minnesota marketplace, but we are also very easy to work with for the members. Very easily accessible. We have an office in Burnsville, Minnesota, but we've also developed these education programs, such as the one you're watching today, to help you better understand what your options are. So, as I mentioned, as an independent agency, my company, Minnesota Health Insurance Network, we work with all of these carriers you're going to see here on the screen today. The main three that we're going to talk about are Humana, Medica, and UCare. And the reason why we're going to talk about those plans and why those plans have information on the actual portal or screen is because we've developed specialized group Medicare plans. So what that means is these are medical plans that are Medicare related, that either work with Medicare or replace Medicare, that are only offered to Education Minnesota members and their spouses. This is truly a separate pool with different options than what you will find if you were to pick up the phone and call these carriers directly. So you will notice that there are two other providers underneath the Humana, Medica, and UCare, and I do also work with those carriers as well. So if you have any questions about those carriers or want to compare a plan with those carriers, I can absolutely help you. But for this website and for this purpose, today we're going to be talking about just the Humana, Medica, and UCare options. So this is Medicare. This is your Medicare card. Okay, so first we're going to talk about what it means to actually have this ID card. So what is Medicare? Well, here's just a general overview, a general definition of Medicare. It's a government program developed for the nation's age to provide financial benefits for health-related occurrences, including hospitalization stays, physician visits, and very limited prescription drugs Now it's important to note that Medicare does not cover drugs you pick up at your pharmacy. However, Medicare, if you have Medicare, it will cover drugs that are administered to you, whether you're in a hospitalization stay or during a physician visit. But if you do want prescription drug coverage from your pharmacy, you would have to buy what's called a Medicare Part D plan, which would cover that. So I think it's important you understand how to qualify for Medicare. And there's three main ways to qualify for Medicare. The first is turning 65. The second is if you're to become permanently disabled for at least 24 months or longer and collected Social Security benefits, then regardless of age, you would be eligible for Medicare. And the third is if you became diagnosed with end-stage renal disease or had kidney failure, you would also be, at that point, eligible for Medicare. So how is Medicare divided? Now here's when we start talking about the alphabet soup, right? The A's, the B's, the C's, the D's. So the first part of Medicare is going to be called your Part A, which would be your inpatient hospitalization services. Now, if you didn't have any other private insurance and you only had your Part A for Medicare, you would have a very limited hospitalization coverage. So if you're inpatient in the hospital, you would have coverage under Medicare. First, you'd have to reach a deductible of a little over $1,200, and then once you did that, then the insurance would turn on and they would cover you for the first 60 days of a hospitalization stay. If you're there days 61 or above, you are going to pay a hefty copay per day for each additional day you end up in the hospital. So you can see there are some limitations, and again, this is the reason why we would purchase additional insurance, to fill in that deductible and to help offset some of those large copays that if you're there for a longer period of time. The next piece is Part B, and Part B is more of your outpatient services. It's also known as your medical services. So what this is Part B also has a monthly premium, but it also has a deductible similar to Part A. Now the deductible is definitely a little bit less than the Part A, but it's important to know there is a deductible for Part B. And then Part B is really known as the coinsurance. And what I mean by coinsurance is if you have Part B and you're in an outpatient service, Medicare would usually pick up 80% of the cost of your bills. You would be on the hook for 20%. So that's what the coinsurance requirement would be. So if you just had Part B, Medicare would pay 80%, you would pay 20%. Now that doesn't sound that bad, but what's important to know is that both under this Part A or Part B, neither of these pieces have what's called a medical out-of-pocket maximum. So what a medical out-of-pocket maximum is it's truly a safety net. So it's a total dollar amount that once you reach that on the medical side, then the insurance would turn on and cover you at 100%. So instead of paying the 80-20 coinsurance forever under the Part B, if you work with a private company, they give you that safety net of having a certain dollar amount. Once you reach that certain dollar amount, in the worst case scenario, then the insurance turns on and covers you at 100% for the rest of the calendar year, as long as you're in their network and as long as it's a covered service. So that's another reason why we work with private companies, is to build in that safety net so that we're not going to be on the hook for 20% of our bills for the entire year, especially if we have some very high cost claims. So what's important to know is that Part A and Part B are what I call original Medicare. Now you have to have both Part A and Part B in order to have any other additional insurance. So that's a key piece, is you need to have both of those. Then we have Part C, and what Part C is that's a Medicare Advantage plan. So that's one plan that's available through a private company. Now you don't buy a Part C plan from Medicare themselves, however you buy them from a private company. Now it's important to know that the Medicare Advantage plans are governed or need to meet certain requirements of Medicare, but again, you do buy those from a private company. And then we have Part D, and what Part D is D stands for drugs. So this is your prescription drug program. This is the drug program that when you go to your pharmacy and you pick up your medications, this is what you need to have, is that prescription drug program. This program is also available through a private company. You do not purchase Part D from Medicare itself. you do purchase it from a private company. But just like the Part C that I mentioned, the Part D is governed by Medicare. So Medicare does set the rules for these private companies to make sure that they have a certain amount of drugs that fall on each of the carrier's formularies. What a formulary is that's just a list of approved medications for each of the carriers. So it's very important to know that for both Part C and Part D, you do purchase those from private companies. Now, how do you pay for Medicare? So for Part A, there's actually no cost, because when you were working or your spouse was working, they were paying into their Social Security and Medicare out of their paycheck. And that Medicare piece was going to cover the Part A. Now, if you or your spouse have not worked 40 quarters or more throughout your life, or 10 years or more, then there would be an additional cost. But if you've worked 10 years or more, then there would be no additional cost for Medicare Part A. Now, the Part B cost is going to fluctuate a little bit. So those of you that joined Medicare prior to 2016, your Part B cost for 2017 will actually be going up to $109 a month. And those of you that are new to Medicare in 2017, this information was just released, so your Part B cost will not actually be $121.80. It'll actually be $134 a month. So it's important to know you're either going to pay $109 a month or $134. The slide shows $121, which is what you would have been paying, but that is new information that was just released, so that will change for 2017. Now, there is an additional premium for Part C and Part D, because the premium is what's offered through the private company. So if the private company charges you a $10 premium, then that's obviously what you'll pay. So let's talk about enrollment periods. So when can you actually enroll into these plans? And I think that's important to know. Now, the first time you can enroll into Medicare is when you're first eligible. For most of us, that's turning the age of 65. This is called your initial coverage election period. So what it is it's really, you have the month of your birthday, you have 3 months before your birthday month, and you have 3 months after your birthday month. It's a total of a 7-month window for anyone that's new to Medicare. And when you enroll, it's actually done through the Social Security Administration. So if you want to start Medicare when you turn 65, you can either go to the Social Security office to enroll into Medicare, you can go to the Social Security website and enroll into Medicare, or you can simply call the Social Security office number and enroll through Medicare over the phone as well. So that's when you want to start Medicare, is when you first turn 65. I always tell people it's important that you start on the front end of turning 65, so 3 months before your 65th birthday, if you want to start on your birthday month. And it's important to know too that Medicare always starts on the first day of your birthday month, unless you were born on the first of the month. If you were born on the first of the month, you will actually start Medicare the month before your birthday month. So if you were born on July 1st, you would actually start June 1st on Medicare. Now, there are some reasons why some people may choose not to enroll into Medicare right away when they're first eligible, and we'll talk about that coming up. Those of us that have a Medicare card already and we're on Medicare and have made a choice for our health insurance, each year we have the opportunity to make changes to our health insurance plan. And each year we can do that from October 15th to December 7th. Now, here's where I always talk about, a good way to remember this is you want to think around the Thanksgiving time. Okay, so when you're sitting down at the table having your Thanksgiving turkey, right before you're about to carve into that turkey, you want to think, okay, I'm thankful, but am I thankful for my health insurance or not? If you're not, that's when you want to make a change so that you can enroll into a new plan that will become effective starting in January for the following year. And the third way, or third time to enroll into Medicare, is actually through what's called a special election period. Now, what a special election period allows is for people that either work past the age of 65 and are getting insurance through their employer's coverage, or they're on their spouse's plan who happens to be actively employed working past the age of 65. So you can choose to waive your right to pick up Medicare when you first turn 65 if you are on a group-sponsored health insurance plan. So once again, what that is that's coverage either through yourself, if you're an employee qualifying for benefits, or let's say that you're retired but your spouse is still actively working. If you're covered underneath your spouse's plan, you can also choose to forego Medicare when you're first eligible and sign up for it later once your spouse decides to retire. Now it's important to note that you do have the option to do that, but you also want to make sure that you don't subject yourself to a penalty for not starting Medicare on time. The key is you or your spouse have to be actively employed. So if you're actively working and you're on a group plan, you can choose to forego your Medicare again until you or your spouse retire. Now, the reason why that's important to know, or why some people actually do this, is because the Medicare Part B cost that we talked about. So the Medicare Part B cost, why pay $134 a month if you're getting coverage through your employer and you're actively working, or through your spouse's employer? So Part A is free, so most people still pick up Part A when they first turn 65, the month of. But for that Part B, since there is an additional premium, you can choose to waive that. And then once you do retire, or your spouse retires, then you enter into this special election period, which will allow you then a couple of months before you retire and a couple months after you retire in order to enroll into the plan, into Medicare. The neat thing with the Education Minnesota plans that you're going to learn about today are that they allow you to actually enroll at any time throughout the year. So if you do decide to retire in June, you can start this July 1st. So a lot of flexibility with these plans. Another nice feature with these group plans that you're going to learn more about today is that these group plans are optional, right? So if it's a good fit for you today, then take advantage of them. But if it's not, and you want to enroll in something else, you feel like some other plan out there is a better fit, by all means, do what's best for you. But know that you always have these plans in your back pocket. You can always join these plans at any time. We've removed any kind of limitation from requiring you to buy this the first time you're eligible or never have access again. So you can truly buy these at any time. So now let's talk about Medicare plan types. And what I mean by these is there's really three types of plans that are available when you purchase health insurance to work with Medicare or to replace Medicare. Now the first type of plan are called Medicare supplements. And the second type are called Medicare cost plans. And the third type are called Medicare Advantage plans. So I'm going to talk about the differences between these plans just to give you a little better understanding about what your medical options are when you start with Medicare. Now the first thing to know is that these are all medical options. So we're not talking about prescription drugs here. At this point we're just talking about medical options. So let's talk about Medicare supplement plans. Now a couple key characteristics to know about these plans is that with the Medicare supplement you actually retain your parts A and B of Medicare. So what that means is that Medicare pays first for all of your medical bills. So if you go to the doctor, you would give them your Medicare card, they would bill Medicare, and then Medicare would work with the private company that you chose in the back end. Again, Medicare is the primary payer for all of your Part A and Part B services. With these plans, you can usually see any provider in the United States as long as they accept Medicare patients. These plans are also available that you can actually take these plans with you if you move to a different state. So it offers a lot of flexibility when it comes to that. But as I mentioned, these plans do not include prescription drug coverage. So if you were to purchase a Medicare supplement plan, you would also have to purchase a standalone prescription drug or Part D plan to go with that. The next set of plans are called cost plans. With cost plans, how it works is the Part A of Medicare is your primary, and then Part B would be covered through your insurance provider. So if you end up in the hospital for your Part A services, Medicare technically pays first, and then they ask for reimbursement from the private company that you chose to work with. if you end up going to an outpatient visit or just to see one of your specialists, then the private company that you chose actually pays first, and then they collect reimbursement from Medicare in the back end. What's important to know about these plans is that there is a network when you're inside of your home state, okay, or service area they call it. So there is a network, so you want to stay within the network whenever you're in the service area. Now, when you're outside of the service area, a nice feature with these plans is that you can see any provider that accepts Medicare. So it does allow you great flexibility when you're traveling, or if you're planning on being gone for 2, 3, 4 months at a time. You can be on one of these plans, and as long as you see a provider that takes Medicare patients, you'll be covered just as if you're in the network. So it offers great travel flexibility. A lot of people refer to this as snowbird coverage. So if you're gone for, again, 3, 4 months at a time, and you want the flexibility to see a provider if you're just not feeling well or things like that, then you can actually take advantage of one of these plans, and it gives you some additional flexibility to be able to see who you want to see on your vacation. Now, these plans may or may not include drug coverage. The cost plans on your comparison sheet and in the next video that you'll see are offered through Medica. So any of the Medica plans are what's called cost plans, and in all of Medica's plans that are offered to the Education Minnesota members, those all automatically include drug coverage in the cost of the plan. So that's important to know. Now, the third and final type are called Medicare Advantage plans. So the Education Minnesota sponsored plans that we have that are technically Medicare Advantage plans are going to be UCare, offered through UCare, as well as Humana. So when I talk about Medicare Advantage plans, those are the two providers you want to be thinking about, is UCare and Humana. So with the Medicare Advantage plan, what happens is that you, the member, you're actually signing your rights to original Medicare over to a private company. So when you think about it, what's happening is that you're just saying that I'm going to run my bills through either UCare or Humana. So I'm going to run all of my bills through them, and then they are going to manage my claims. So what happens in the back end is that when you assign your rights to this private company is in charge of making sure that they manage your claims. Now, in order for the private company to accept the risk, they're actually being subsidized by Medicare themselves. So the private company is collecting some money from you in premium, but they're also collecting money from Medicare each and every month, because Medicare is basically washing their hands of you for this year as far as having to pay your claims, because again, you're running everything through that private company. Some people like this system because they have one ID card, and it's very easy to track the bills and manage those type of things along the way. Now with this though, is you definitely want to make sure you stay within the network, because outside of the network is usually going to cost you more, so it's usually going to be more expensive. Now it's important to note that whenever you're traveling, if it's an emergency, or even if you're at home and if it's an emergency, just go in. You're going to have coverage. You're going to be treated just as if you're a network. So emergency coverage is treated just as if you're a network, regardless of whether you're outside of your service area or in your service area. But really what you want to pay attention to is if it's not considered an emergency. So if you're just not feeling well, or let's say that you're going back in for follow-up visits and things like that, on these plans you really want to make sure that you're in the network for those situations. So you want to make sure you understand truly how the travel benefits do work and what you're looking for out of a plan. And finally, these plans automatically include prescription drug coverage. So if you're looking for one of these plans, and again, on the Education Minnesota sponsored plans, they are going to automatically include the prescription drug coverage. So now let's talk about the prescription drug side of things. Now let's talk about the Part D. So what Part D is, again, is it's insurance for your medications that you pick up at your pharmacy. Now it's important to note that, as I mentioned earlier, Medicare does cover some drugs that are administered to you in the doctor's office or in an outpatient setting. Now those drugs are usually the really expensive ones that are infused to you while you're under the care of a provider. So usually you can think of chemotherapy. Now not all chemotherapies fall under this level, but the standard chemotherapy usually does. And what I mean by the standard chemotherapy is when you go into an outpatient setting, they hook you up to an IV, you sit in the chair for 3 hours, and then you come home that same day. That standard chemotherapy will usually fall under what's called your Part B services. And the reason why that's important to know is because when it falls under the medical or the Part B services, any of the cost that you pay goes towards that safety net that we talked about, that medical out-of-pocket maximum. So if you reach that medical out-of-pocket maximum, then you'd be covered at 100% for the rest of the year, as long as you're, again, in the network and as long as it was a covered service. So for most people that get chemotherapy, that's usually covered with the medical side, which is great for them because then their insurance turns on and covers 100% a lot quicker. On the prescription drug side that you pick up at your pharmacy, otherwise known as your Part D coverage, there are also some chemotherapy drugs that you do pick up at your own pharmacy and that you administer on your own. In that case, you could be subject to this donut hole or this coverage gap. So again, it's important to know that on the prescription drug side of things, a couple of things. Number one, you buy a prescription drug plan through a private company, like we talked about earlier. Number two, each private company has their own what we call formulary. And again, what a formulary is it's a list of covered drugs for that specific carrier. Now, Medicare sets the rules for these providers, as I mentioned earlier. What Medicare says is there's basically 26 different disease categories. And if you want to be a private company that offers a drug plan, you have to have at least 2 medications in each of these disease categories. And whatever 2 medications they pick are called their formulary. So a lot of providers are going to cover much more than that. Okay? But it is important for you as a consumer to understand, are your specific drugs covered under the formulary? Because if your drugs are not covered under the carrier formulary, then you're going to pay 100% of the cost of that drug for the year. Now there are always exceptions. You can get exceptions to the formulary, you can get drugs added, things like that, but there are also no guarantees. So in order to get an exception, you'd have to fill out the appropriate paperwork and complete all of that additional information in order to be given a judgment whether your drug will be moved to the formulary or not. So when you're shopping for the insurance, I really suggest that you focus on the formulary, make sure your drugs are all covered. So on the medical side of things, there's something called the coverage gap, or otherwise known as the donut hole. Now on this slide, we're going to talk about what that means. Now, when we talk about the donut hole, it's important to know a couple of things about the donut hole. Number one, the donut hole only pertains to the medications that you pick up at your pharmacy. So it only pertains to the drugs that are actually fall underneath your prescription drug plan or your Part D plan. Number two, the donut hole changes a little bit each and every year. So the government is trying to close this donut hole gap or this concern for people by the year 2020. So each year these numbers are going to change a little bit. And number three, the donut hole resets every year. So it runs January through December and then resets for the next following year. Okay? One more major thing that you should be aware of with the donut hole is that it only affects people that have drugs that retail cost for $3,700 or more over the course of a year. So what that breaks down to is about $308 per month. So if you're only on a couple generic drugs that are $10, $15 in retail cost, you're nowhere near this donut hole. But if you have expensive medications, if you have 3 or 4 medications that are all $100 a piece, then this will be a concern at some point throughout the year. So with that being said, I'd like to explain the donut hole or the coverage gap on the 3 levels or 3 stages that are actually pertinent to the donut hole. So stage 1 is actually called your initial coverage. So when you buy a health insurance plan and you pick up a drug plan, the drug plan itself will tell you what co-pays or co-insurance you'd be required to pay based on the drugs that you have. You continue just to pay those co-pays or co-insurance. Whatever the plan is you bought, you pay what your agreement was. And you keep paying that agreement until the total cost of your drugs. Now when I say total cost, what I mean is the cost that you pay plus the cost that the insurance company pays. So the total combined cost of the drug. Once the total cost reaches $3,700, then you enter into the donut hole, or stage 2. Now when you enter into the donut hole, what happens is basically your insurance turns off. Now this is very important to know, because in the donut hole you're going to pay a significantly larger portion of your drugs than you were before the donut hole. So your insurance turns off, but you're not stuck in the donut hole forever. So what happens is that your insurance turns off until you pay up to $4,950. And once that happens, then your insurance turns back on, which is called stage 3, or the catastrophic stage. And when your insurance turns back on, then you would pay 5% of the remaining cost of your drugs. So really the donut hole is that stage 2, a time that your insurance would turn off. Now it gets very confusing when we're talking about the donut hole, because there's really 2 different numbers. If you look at stage 1, they're looking at the total cost of your medications. Once the total cost, which is again what you pay plus the insurance company pay, reaches $3,700, then you enter into the donut hole. But in the donut hole in stage 2, they're looking at a different number. They're looking only at what you've paid out of your pocket. And once what you've paid out of your pocket reaches $4,950, then you enter into stage 3. So let me give you an example. I think it's easiest with an example. Let's say I'm on a drug that is $1,000 cost per month. So the total cost of my drug is $1,000 per month. But let's say I have wonderful insurance, and on my insurance, they're only going to charge me $100 per month copay. So what happens is in stage 1, the Medicare is keeping track of the total cost of my drugs. And that's that $1,000 a month. So once I'm on that drug for 4 months, I will then exceed that $3,700. So if I'm on the drug for 4 months, then I enter into stage 2, because again, the total cost of my drug reached $3,700. So now I'm in stage 2, and remember, I was only on that drug for 4 months, and that put me into stage 2. In stage 2, they don't care that my drug cost $1,000 a month. They only care that I paid 4 copays of $100 each. So in stage 2, I've only paid $400 out of my pocket. In order to leave stage 2, I need to pay my drugs until I pay an additional $4,550 out of my pocket. So I'm given credit for the $400 that I paid, but I need to pay an additional $4,550 in order to leave stage 2 and enter into stage 3, which is the catastrophic insurance. At that point, my insurance would turn back on, and I would pay 5% of the remaining cost of my $1,000 drug. So that's how the donut hole works. Now it's important to know that, as I mentioned, the government's doing their best job to close this donut hole gap, and so each and every year they're now giving you what's called discounts. So if you find yourself in the donut hole, you no longer have to pay 100% of the cost of your drugs. Now they're only charging you 51% for your generics and 40% for your brand name drugs. So in the same example, if I was on that $1,000 drug, I'm still reaching that month 4, but if that was a brand name drug, I don't have to pay 100% of that brand name drug in the donut hole. For 2017, I only have to pay 40%. So I would pay $400. Now what's important to note is even though I'm only paying 40% in stage 2, Medicare is actually giving me credit as if I paid 90% of that. So they're giving me credit as if I paid $900, but I've really only paid $400 in the donut hole. It gets very confusing, but that's how it works. Medicare will give you 90% credit even though you only paid 40% for the brand name drugs, and even though you only paid 51% for generics. So really they're trying to shrink that donut hole, and once again by the year 2020 that will be achieved. So that's the donut hole. So here's what I feel is one of the most important slides of the entire presentation. What you want to look for in a Medicare plan. So I think it's extremely important that you understand the formulary. So each provider under their prescription drug plan is going to tell you what their formulary is. They're going to have a list of covered medications. You want to make sure that your drugs are covered underneath their formulary. You want to understand what it's going to cost you out of your pocket to pay for that drug. Even though two different carriers may have the same drugs covered, one carrier may call it a preferred generic, where you'd only pay up to a $10 copay, and another carrier may call it a non-preferred generic, where you pay up to a $20 copay. So you really want to understand how your drugs are covered, and you want to make sure that you know what you'd have to pay for that drug. You also want to take a look at the out-of-pocket costs. So on the main page where you found this video, you'll also see 3 additional videos, one from UCare, one from Medica, and one from Humana that talk about their specific plans. Pay extra attention to the out-of-pocket costs. Another thing that I've done for you as well is I've actually created a grid or comparison spreadsheet. So above the videos you'll see a link for the comparison spreadsheet. On the comparison spreadsheet you'll be able to see a side-by-side comparison of all of the Education Minnesota sponsored plans. On that grid it'll include links to the formulary so you can search and make sure your drugs are covered. It will also include a comparison with the out-of-pocket costs for each of the medical plans. Again, what the out-of-pocket cost is that's your worst case scenario on your medical side. So if you have very expensive bills, once it reaches an out-of-pocket cost, you're then covered at 100% for the rest of the year, again as long as you're in the network and as long as it's a covered service. Next you want to focus on the networks. Now on that comparison grid that I mentioned, there will also be a physician finder. So you can click on that spreadsheet and it'll bring you right to each of the carrier sites so you can search and make sure that your providers that you want are going to be covered in their network. You obviously want to stay with network providers. Now with that being said, all of these carriers through UCare, Humana, and Medica have very, very large networks. So usually it's not a concern, but that being said, if you have specialists or things like that, you still will want to confirm that your providers are in network because you get the best benefits when they're in network. Third, you want to evaluate, are these reputable companies? Are these good companies? Now, we evaluate this each and every year, and we're proud to say that we're very confident in Humana, UCare, and Medica. So we feel they're very strong companies. They've serviced the members very, very well over the last 8 years, and they've done a wonderful job for our program. And finally, service and communication. Now here, what I say is, you want to make sure that you're buying an insurance plan for yourself. In the Medicare world, there are no more family plans. So you don't buy on a family policy. Once you turn Medicare age, or once you qualify for Medicare, you're truly buying the plan that best meets your needs. What I mean by that is that you are probably going to have different medication needs than your friends or than your spouse. And you may have different doctors than your friends or your spouse as well. So if your friend or your spouse says you need to buy this company because this is the best plan, take that recommendation with a grain of salt. You really need to make sure that you're buying what's best for you. This last slide that I have for you is just some contact information for the Medicaid Center for Medicare and Medicaid Services, which is called CMS, and then also the Social Security Administration. Now remember, those of you that are turning 65, that's where you actually enroll into Medicare, is through the Social Security Administration. You'll also see in the bottom of the page you have my direct line. So that's a 1-877 number, but it does come directly to my desk. So if you have any additional questions, you can feel free to call me. And then obviously you found the Education Minnesota website, and that's why you're viewing this video. And that's all I have for you today. So I'd like to thank you for your time, and I please encourage you to take a look at that comparison spreadsheet that I created on the Education Minnesota website, and I'd also encourage you to take a look at each of the carrier videos. Thanks again and have a great day.